Our top story this afternoon, the number of daily COVID-19 infections in South Korea on Wednesday soared well past 13,000, recording the highest figure ever reported in the country. On the same day, health authorities are starting to adapt the virus prevention measures specifically to tackle the spread of Omicron. Our Shin Ye-eun starts us off.
South Korea on Wednesday recorded 13,012 new infections, the highest amount ever recorded in the country. This is up by more than 7,200 from the same time last week. Health authorities have said that with Omicron becoming the dominant strain, Korea is set on seeing a doubling phenomenon, which means that the number of new COVID-19 infections will double at speeds we've never seen before. With infections expected to increase from this more transmissible strain, the Prime Minister spoke of changes to virus prevention measures.
We shouldn't be complacent, but we don't need to be overly anxious about this situation. The government has been preparing in advance for Omicron by administering booster shots and antiviral pills to more of the senior population. Now we will prioritise bringing the number of critically ill and deaths down and give out exact information as to what Omicron entails and how we can tackle it.
Authorities are changing virus prevention measures specifically targeting Omicron from today. Some key changes taking effect from Wednesday include only conducting PCR tests on high-risk groups and those suspected to be infected. Everyone else will use rapid antigen test kits at the testing sites instead. These measures will first be introduced in 4 regions hit hardest by Omicron, like Jeollanam-do Province and Pyeongtaek City in Gyeonggi-do Province. Authorities have also made changes to the number of days a person infected with COVID-19 has to self-isolate, based on their vaccination status. For infected people who have been fully vaccinated, the quarantine period has been reduced from 10 days to 7. Those who haven't been fully vaccinated must stay in self-isolation for 10 days. Under these new measures, to be considered fully vaccinated, 14 days must have passed since the person received their second jab or booster. But if over 90 days have passed, they would be considered unvaccinated. Shin Ye-eun, Arirang News.